Hello, everyone, and welcome to Bulk Up Your Profits. I'm David Rice, and I am so excited to be with all of you this evening. This is an amazing time for us to be in dentistry. In fact, it's really the first time in the direct restorative space that we can truly say clinical excellence is meeting maximum efficiency. And I love that because the reality is, for many of us in dentistry, posterior composite, it's our workhorse. It's what we do all the time. It happens in my practice. It happens with my personal schedule. And let's face it, our workhorse, it needed a little work. So with that, I'm going to give you a little backstory to me just as a reference. I'm you. Now I'm sure some of you on this webinar tonight have been practicing a little bit longer than I have, and I would imagine some of you have been practicing less. So I've been doing this dentistry thing for 24 years now out of Buffalo, New York. I have two partners, and I would say that our practice has a very active restorative element to it. We see adults, some kids, but mainly adults. And we do a considerable amount of big case dentistry. However, at the end of the day, just like many of you, our bread and butter, our workhorse, is the posterior composite. That's the procedure I see on my schedule multiple times every single day. So, here's where we've been in dentistry, and think about what we've had to do to make sure that we delivered an excellent clinical result to our patients. Avoiding shrinkage stresses required us to do incremental fill, like you see in this image, in order to get a complete cure, which, oh, by the way, is the #1 failure point for composite resins, required us to incremental fill. When we wanted to maximize aesthetics to create restorations that had great harmony, it required us to incrementally fill. So when you add all of those factors together, what did you and I need plenty of to essentially deliver outstanding results? What did that take? It takes time, right? So think about that process for you. I'm sure it's a lot like the process was for me. Layer 1. Place it. In my hands, it was typically a flowable composite. Then I teased it. Then I cured it for 10 seconds. Layer 2, placed it, packed it, cured. Layers 3, layer 4, layer 5. I know I don't have to explain it to you all. You've lived it. And the question is, have you ever really tracked exactly how much time you spend doing that? Because it's a considerable amount of time. So I mentioned a couple seconds ago this point right here. The #1 failure point in posterior composites, it's incomplete cure. Now, that incomplete cure can happen for several reasons. It can be a curing light issue. Maybe your light is underperforming. Maybe you have the wrong light. It's something that we have to pay an awful lot of attention to. Not all curing lights in dentistry were created equally. In fact, those tips on the curing light have a huge impact over our ability to cure, whether it's straight, tapered, it's curved, whether it has a flat head to it. All of those impact our ability to cure. So, second factor behind the cure really is patience, because let's face it, you and I have often treated a traditional composite like a bulk fill. We've attempted to put too great a volume of composite in a tooth at one time and cured it. So that's another reason curing becomes an issue for us. With that, I really want to talk about, over these next couple slides, the next 3 slides, 3 big questions that I want you to ask yourself. The first one is this: what is the cost to you, to your practice, of inaccuracy? Because here's what I know. I take a lot of pride in my dentistry. I'm the type A, I'm very meticulous, but that said, no matter how good I am, the more increments I place into a prep with a traditional composite, the more layers I have to place, the more room I introduce for error. So does that make sense to you? I mean, no matter how good you and I are, when we pack 4, 5, or 6 layers into a prep, each one of those layers introduces more potential for microgap. It's just the nature of the beast. It's not good or bad, it just is. So the question is, does that contribute to failure? And the answer is, of course it does. Now, how soon it contributes to the demise of a restoration depends on where those microgaps are. So second question is this: what is the cost of retreatment? What is the cost of a patient of yours coming in at recare, whether it's 6 months later, a year later, 2 years later, or 3 years later, and your hygienist takes bite wings, you see marginal breakdown, and when it happens, think about where it happens, right? It's typically the floor of a proximal box. It's not an area that's easily accessible, and you and I are forced to go there and redo dentistry. And in our practice, we redo that dentistry at no charge. So I'm not sure what your policy is, but they don't happen often in our practice. But I'll tell you this, I'd be a liar if I said it never happened. And in our practice, our policy is really simple. If we have a great patient, if as a patient you're reasonable with your home care, if you show up to every single recare appointment as you're scheduled and something goes wrong, at any point in time in those first 5 years, we retreat. No questions asked, the treatment's on us. But imagine what that would cost us if we had to retreat very often. We'd be out of business, right? You and I have to have control over as many of the factors involved in this process as we can. Here's the big one. And I don't know if you've ever asked yourself this question. If you have, pat yourself on the back, because this is the ultimate business person's question. What is the cost to your brand when your dentistry fails and your patient has to come back to redo it? When your dentistry is perceived to take too much time, even though you and I know that time invested on our end is a good thing. It's what defines us. It separates maybe our practice from other practices that have to rush through things. That's not always the patient's perception. That impacts our brand. So when, for whatever reason at all, you and I don't deliver a great patient experience, what's the cost of that to your brand? That's the big one we need to know. Let's take a look at some of these. These are just some simple statistics that you could find if you Google, but they're powerful. It's a fact, and some of you have heard this before, that Americans tell an average of 15 people every time they feel like they had a bad experience, compared to 11 people every time they've had a positive experience. What is the impact to your brand when somebody has a negative experience and they're coming back to retreat dentistry? Or, like I said, it's simply, in their mind's eye, takes too long. Here's another one. 51% of customers say that they will never do business with a company once they've had just one negative experience. And how easy is it for that to happen in a dental practice? I mean, we work in a very invasive space. We're in people's face. It's already an uncomfortable place. They're already anxious. And anytime there's an opportunity for us to improve our process and deliver a better experience, we have an opportunity to improve our brand. Powerful one, right? As millennials now, just FYI, the millennials out there, so if you're a boomer, if you've been doing dentistry for 30 or more years, if you're a Gen Xer, you've been doing dentistry as long as I have, hey, maybe we've got a couple traditionalists on here and you're in your 70s. We have some great dentists in our community who are those dentists. They love it so much, they just keep doing it. But millennials as a group are willing to spend 20% more for great customer care, for great experience. And understand this, that whether we like one generation over another or not, millennials are the #1 spending power in the United States today. So these guys and gals are important patients, and they're the lifeline. They're the future of all of our dental practices. We have to understand, as we assess our practices when we try to become more profitable, that this demographic is almost a quarter more likely to spend more money with us when we deliver a great patient experience. So dentists oftentimes get hung up on PPOs, they get hung up on practicing longer hours, they get hung up on practicing extra days of the week, when in reality, a lot of times when we can dramatically improve our patient experience, we can dramatically improve our results. We've got a massive opportunity to do that with today's restorative materials. So last one I'll go through is this data point. Increasing customer retention by only 5% will increase your profits anywhere from 25 to 95%. It's a staggering statistic, and I want each of you to think about this, because some of you probably invest a hefty amount of money in bringing in new patients. You invest dollars marketing, you certainly invest a lot of time, your team members invest a lot of time. Go anywhere online, and if you're on social media in any way, shape, or form, you can't scroll 30 seconds down your timeline and there's at least a half a dozen people who are marketing to you and I on how to build social media marketing that drives new patients to our practice. Now, is that important? Of course it is. We all want new patients to come in the door. However, understand this. Most of us as dentists and dental practices, the problem isn't that we're not getting enough new patients. The problem is they're all leaking out the back door of our practices. So if you're going to invest time, if you're going to invest money, doesn't it make sense to improve your patient experience by 5% and really grow the profits in your practice? And do that by doing what you already do, simply by doing it at a higher level than you're doing it today. So the business world knows that, right? They just label it a little bit differently than you and I would. We talk about reputation and reputation management, and they say this, they say brand. So Apple is the #1 brand in phones. Google is the #1 brand in search engines. Microsoft is the #1 brand in software. These guys, Facebook, still to this day, despite Instagram, Snapchat, all the other folks out there, Facebook is the #1 brand in social media, and Amazon is the #1 brand in retail. And together, I mean, think about those 5 companies. By Forbes count, those 5 companies weigh in at over $586 billion. And they represent the 5 most powerful brands in the world. So the question you and I have to ask each other and ask ourselves when it comes to our dental practice is this: what are they really good at? What separates them? They're phenomenal at this. They're phenomenal at seeing a gap in their industries, in their respective industries, and developing a solution that makes it easy for their customer to say yes. So let's apply this to dentistry. Think about where we have been, that slide I showed a few slides ago that talked about how many layers we place in a composite. Think about the time it takes on our end. Think about the patient perception of that time in their very busy lives with kids who are going to school and dance and soccer and football and baseball, and their jobs are stressed and they're being pulled in a lot of directions. Think about your practice as a brand, just like those five companies do. Think about the problem, and now think about a very simple solution in a restorative space in your practice, that is an easy answer. It's an easy win. So that's where bulk fills kind of came into vogue in dentistry. Companies like DMG saw the gap and they delivered an outstanding solution. They delivered a solution that instead of having to cure 10 seconds 5 times, it's one 20-second cure, up to 5 millimeters of a layer. There's low shrinkage stress, so you and I don't have to worry about postoperative sensitivity. We can bulk fill that restoration prep that we've made without worry. It has excellent adaptation and packability. This is the stuff that you and I worry about. If we're putting in one layer, how is it going to perform? It does that well. It polishes well, which means it not only looks pretty on day one, but it means it's going to be resistant to biofilm accumulation as time goes on. We know we need to have that. It doesn't stick to instruments. I don't know about you guys, but one of the things that drives me crazy is when I'm packing a composite and I'm packing it in the proximal box and I pull a plugger out or I pull a plastic instrument out and out comes my composite. That doesn't work for me. It releases fluoride. This is huge. We talked a little bit earlier about fail points of composites, number one being cure, but number two is gap. And the fact that we have a restorative material now that not only does all of these lists of things that we've mentioned already, but it releases fluoride, we know we not only can achieve a good mechanical seal by the properties of the material, but the material is working for us time and time again as our patients wear it for 2 years, 5 years, 10 years. And this material is great. Obviously, our focus tonight is talking about posterior restorations. So here's our gap, right? Our number one, resource that we cannot create more of is time. And for decades, we've lived with that middle image. And then, we graduated to systems that have improved it. So if you look to the image on the left-hand side, we moved to bulk materials that could be placed in 2 layers. We could place a fairly large increment, but we needed to have a capping layer. Now that's a massive improvement from 5 layers, right? 5 layers to 2 is great. Now really cool is when we can pack one single layer of EchoSit up to 5 millimeters in depth. And that's what you're seeing on the right. It's one layer, 5 millimeters, 20 seconds, and move on. So we can go from a situation like this to this. I mean, this is what you and I do all day, every day. We diagnose, we treat, we prep. Piece of cake, it's what you do. To this. We can do that in one layer with one 20-second cure per tooth. We can count on the adaptability. We can clearly count on the aesthetics. We can count on the polishability that you see in there. And you and I, we can count on this. This is functionally what we need to pay attention to. This is another form or problem we had to solve when we had multiple increments in the past. We had to do all these different layers because of shrinkage stress that existed. We don't need to use all those layers today. So this is another one that you and I think about all the time. If you look at the differences in the composites, I'm not trying to say the others are bad. They're not. They're good products. But compare that to the image of EchoSit on the right, the bulk fill. It's one homogeneous nanofilled restoration. Now, this isn't a lecture on the clinical strengths of EchoSit over other bulk fills. Our focus this evening really is the impact of this material on your practice profits. But that said, I had to put in a few clinical images to show you how good EchoSit really is, because how long it survives in our patients' mouths directly influences our bottom line. Based on those 3 questions that I posed a few slides ago, what is the cost of inaccuracy? If this isn't going to last, it's extremely costly. What is the cost of redoing dentistry? If we don't have the science behind the material, it's extremely costly. And what is the cost of those chair time, etc., which directly affect patient experience and therefore compromise our brand. So let's look at this. This is the difference between what many dentists do and dentists who somehow have that incredible practice in every community. And you know them. A lot of you on this webinar tonight are that practice. But what's the difference between that practice and every other practice in town? And it's the dentists that have that practice. They start with a vision. They start with a culture. They build a great team who can execute on that vision and culture, and they absolutely have a strategy. Bulking up your profits, in my humble opinion, it never happens by accident. So I love this image. In fact, one of my favorite young dentists, Dr. James Wanamaker, he's an upstate New York guy. He introduced me to this image in a presentation he had built for dental students and other young dentists that he and I work with an awful lot. And so James gets total credit for this image. But I'll give you a double-edged sword, the phrase, don't sweat the small stuff. I agree that you and I, we don't need any more stress in our lives. What we do is tedious, staring at 1.5 millimeters by 1 millimeter, dealing with anxious patients. But what I will challenge is sweating the small stuff when it comes to being highly detailed in our strategy, when it comes to looking at our metrics for our practice, for our business, and how we track our success and how we track our time, because those two are intimately related to one another. So there are two really big ways to grow your business profits. You and I can go out there and we can produce a heck of a lot more dentistry, and we can collect money based on that higher production. And you and I can, we can streamline our overhead. Now, I'm not a fan of lowering my overhead by using inferior products. We know that doesn't work, and in the end, it's going to lead to all of those three questions being fails, right? We're going to lose money when we stop investing in quality materials and quality technology and quality team members. We have to invest in the very best we have in dentistry if we're going to be successful. And at heart, I'm a health care professional first. I've always believed that if I do the right thing all day, every day, my reward is going to be a successful practice, and then I get to earn a great living. I am, however, a fan of lowering my overhead by working smart, not hard. So let's take a look at this example. This is a really simple example, but I know that you're going to see at the end of it that it's a very, very powerful example. And you can do this with every single procedure in your practice. I would highly, highly recommend you minimally do this with all the procedures that you do day in and day out, whether it's on the restorative side of your practice or the hygiene side of the practice. All the top practice management softwares out there make this really easy. It will take you all of about a 30-minute sit down with your administrative team to share with them some key practice indicators, the key procedures you want to look at, but have people really focus on simple things like this, and you're going to see with me this evening how impactful this can be when it comes to bulking up your profits. So let's pretend, for argument's sake, that you're currently placing a traditional composite. And for simplicity's sake, we're going to set the bonding protocol aside. So we're comparing apples to apples, because everybody in this webinar is bonding differently. Some people here tonight are total etchers, some are partial etchers, some are self-etchers. So we have to remove that from the equation as we simply look at the cost of placing a traditional composite as it compares to the cost of placing a bulk composite, especially one that we can place in 1 5-millimeter increment. That's really, really key. So if you're following material guidelines, you're minimally placing 4 layers of composite in the average amalgam that you're pulling out, the average MOD that you pull out of an upper first molar or a second molar that's been there for 20, 25 layers, 25 years. So, maybe your first layer is flowable like it would be for me, and the other 3 layers are packable. And let's say you're pretty darn good at what you do. I'm going to try to give you all the assumptions as if you're the best you can be in the old school way and just average with the new school way. I know you're not average. I know you're above average, but I want to create this scenario so it gives you a minimum to look at and understand that profits can be much greater than this when you really perform at a high level. So let's assume that you're pretty darn good at what you do, and it takes you 15 seconds per layer to place composite, to tease it if it's a flowable, to pack it, sculpt it if it's one of the other 3 layers. So that's 40 seconds per layer, and we're going to assume 4 layers, so we have some easy math. So it's a little better than 2.5 minutes. It's like 2.66 meetings, but let's just call it 2.5 minutes. Now, I think we can agree that if you were able to restore that average MOD on a first or second molar in 2.5 minutes as far as placement of the composite and getting it all cured, that's moving pretty good. And that means you and your assistant are firing on all cylinders, but for demonstration's sake, I'd rather err on that side that you're already pretty fast. Because if it takes you longer, like it does most of us, including myself, you'll be saving even more time. So now let's look at this. Let's look at EchoSit Bulk. Think about 1 layer to accomplish the same goal. 1 layer, and let's take a little bit more. It takes 30 seconds to place and sculpt and 1 20-second cure. So now, instead of that 2.5 minutes, we're looking at a total time of 50 seconds. In order to place that, 50 seconds. So now let's take a look at what happens in your practice. And I'm going to look at my practice as one example, but you know your numbers, so sit down and go through this exercise. But I'll share mine. So we have 3 dentists in our practice. I said earlier I have 2 partners. And between us, we place an average of 36 composites a day. Now we know, right, we went from 2.5 minutes down to 50 seconds. So at 36 composites a day, at 4 days per work week for us, and at 48 weeks per year that we work, you may work more, you may work less, we each work about 192 days. Times 3 of us is 576 total work days. So we've got time saved per tooth at 110 seconds, we've got 36 teeth per day, and we've got 576 days for the year. That's what it translates to. 2,286,960 seconds. That's 38,000 minutes and 633 hours worth of time that we saved by taking the restorations that we're already doing all day, every day, and simply being open to change, which isn't always easy, but understanding that we've got a better, more predictable way to deliver that process today. So I'm going to walk you through this slowly for one reason, right? What do you think every dentist says to me when I say to them, if you're willing to switch gears, if you're willing to change the way you look at things, which I know isn't hard, you're going to save about 1.5 minutes per tooth. Every dentist is like, it's a couple of minutes. But if you work 4 days a week in my practice, it means we've saved 633 hours. If you're a solo practitioner, if you're doing this by yourself and you roughly treat the same number of patients as one of us does, divide it by 3. You've saved 211 hours. So here's my next question to you. How much dentistry do you produce in an hour? How much more profitable are you when you just found an extra 211 hours per dentist per year. Friends, I gotta tell you, if you work a 7.5-hour day, that's 28 more days worth of opportunity per dentist. That's a month free every year. Now you can do whatever you want with that month. You know your current monthly production and collection numbers. So you can maximize those hours and you can increase your bottom line every year by an entire month by just adding more dentistry because you've saved all of that time. You can choose to say, you know what, instead of 4 days a week, I want to work 3.5 days a week. You can use the saved time to do the exact volume of dentistry that you're doing right now, but you can spend 1/2 less day per week times 48 weeks a year than you're currently working. You can give your patients the same amazing restorative level of care, and you can have more downtime on a weekly basis. Or you can take an extra couple of weeks vacation. It's up to you, really. It's, I'm not trying to share what you should do and how you should do it, but think about the power, think about the leverage you have simply by maximizing the best technology in the #1 workhorse procedure in your practice. It's not glamorous, right? It's not 3D printing, it's not CAD/CAM, it's not cone beam that if you go on social media, everybody's talking about. Those are the pictures everybody's posting. It's the coolest stuff in the world to do, and I love all of those procedures. But ask yourself this, is it equally impressive in the result it's going to deliver to the bottom line of your practice? So, I love big case dentistry. I do a lot of it in my practice, but the reality is this, right? This is in all of our practices all day, every day. This patient is sitting in your chair as a new patient. This patient is sitting in every one of your hygienist chairs all day, every day. Multiply that times 1 hygienist, 2 hygienists, 3 hygienists, however many you have. This is simple bread and butter dentistry, right? How many patients do you see that have 20, 25, 30-year-old amalgams sitting in their mouth? We treat an awful lot of teeth with posterior composites. I want mine to have great form. I want mine to have great function. I want them to be highly aesthetic. And you know what? I'm not ashamed to admit this. I want to be profitable in the process. That's what we do this for. So I want to share with you one more brand, and I know you know these folks. So Uber. 9 years ago, Uber comes to market. So it's 2009, and prior to that, up until that point, when you and I wanted to get from point A to point B and we didn't feel like driving other than taking a bus, the only ride share that existed was yellow cab, right? Or, taxi, whatever the taxi is in your town. But assess in today's world how many times when given the choice, you choose a taxi cab compared to Uber. What business model, whether it's Uber or Lyft, who's crushing it now? And think about why they're crushing it now. They deliver rideshare excellence, right? They're delivering an excellent restorative product. They deliver it efficiently. They understand, just like our patients, that our time is highly valuable. We have technology now with the bulk fills in order to mimic that in our arena. So as customers of Uber, just like patients of our practice, people can have a tremendous result. They can have a tremendous experience, and by the stats we showed earlier, people are a whole lot happier to pay for it. We have that same opportunity in dentistry. So I'm gonna share this with you. I don't do a whole lot of webinars on behalf of companies. I speak about 45 times a year live. I don't do a whole lot of live education on behalf of industry partners. The reason I said yes to DMG and to Ecosit is really one. I love the material. I love the bill fill. In fact, I love a lot of what DMG puts out. They don't try to be all things to all people. They don't want to have a product in every space like some larger companies do. They try to be a jack of all trades, and sometimes that works out and sometimes it doesn't work out. But they're a lot like those 5 brands we talked about earlier. They're a lot like Apple. They're a lot like Google. They're a lot like Microsoft, Facebook, Amazon, and even Uber. They focus all of their energy on delivering an excellent product to you and I in very specific spaces, and I really appreciate that. And I really appreciate all of you for joining us this evening. This has been an awful lot of fun for me. I truly love these guys and what they do, and this is my contact information. I want you all to please feel free to connect with me at my email. It's david.rice@ignitedds.com. We've got a great website. We work with a lot of young dentists, a lot of dental students, and some seasoned ones too at ignitedds.com. You're more than welcome there. We have brilliant mentors in all phases of dentistry. There's lots of great information and free resources there. Everything we do is to provide other dentists the knowledge and the power to be as happy as we all are in dentistry, to be successful in dentistry. I've been so very blessed with many great mentors my entire career, some of whom I know are on this webinar with us tonight. I truly appreciate them. I truly appreciate all of you and your time. And at this point, I want to open it up to any questions you might have on how we can best deliver success to your practice. Let's see here. Questions. All right. Our office still uses amalgam fillings. How much profit do you think we are losing? Super question. So as far as profit goes, you know, I look at that a couple of reasons. So what are the strengths of amalgam? You know, the strength of amalgam is efficiency, right? Let's face it, if we're placing amalgam, we can place that amalgam in a space where maybe moisture control isn't quite as important as it is with a composite. No matter what composite system you and I are using, we have got to have good isolation, great retraction of tissue, things of that nature. There's a lot of ways to do that. How much profit are you losing? I'm going to defer that one to the question of brand and who do you want to be in your community. Now, if you're placing a lot of amalgam and your patients love you for it, that doesn't mean you should stop placing amalgam. I'm not sharing that amalgam is a bad material. I would say in my hands, composite is a better material today than amalgam is in the past. Amalgam, what I can see is it's going to last 20 years, 25 years, and in some cases a little bit longer. I know some of you out there have seen and probably placed amalgams that are lasting that span of time. I'll share with you this. That's an incredible result as far as duration. However, my problem with amalgam in today's world with the materials that we have is when amalgam does fail, it fails big. So it goes from an MOD or an MO or a DO typically to a core buildup and full coverage. I rarely see those big MOD amalgams turn into another big MOD amalgam, so it graduates dentistry. I think in today's space we can be much more conservative and retain much more tooth structure. And I've always looked at dentistry as our job is to bank natural tooth, because this is a race against time, right? Nothing we do is going to last forever, so our job is to try to bank as much natural tooth as we possibly can. Let's see. Your work looks very nice. Thank you very much. I appreciate that. Can you run through your technique, matrix, bonding agent, etc.? Choosing shades with Ecosit relative expense, and do I always use a rubber dam? So I'm going to try to hit a few of the points on this. Let's see. Matrixing. I'm a sectional matrix fan. There are a lot of good ones out there. I use Garrison in my practice, but if you look at Garrison, Triodent, Palodent, Quite honestly, what I'd share with you is this: most of the systems are identical. In fact, they're made in the same place, and then they get white labeled so people can rebrand them. But I use Garrison. I've been a fan for a long time. I'm definitely a fan of the sectional matrix. In my hands and my experience, I have found that it helps me to create outstanding proximal contacts. You're not going to miss. It also creates really, really nice contour that's self-cleansing for patients. And let's face it, as good as you and I are, our dentistry is only as good as our patients can take care of it. As far as shades go, I'm a basic guy. You know, if you and I had this conversation 10 years ago, I'd probably tell you I had 10 shades of composite, and I'd probably tell you when I was making a crown, I had 10 shades of stacked glass in a crown. But the fact is, 80% of our patients would absolutely love the dentistry that I showed you on some earlier slides. One of the nicest things about EchoSit is it has some good translucency forms to it. It's going to pull color from the natural tooth. So harmony is really what I'm after, and it does a really, really nice job of that. And as far as isolating with the rubber dam, I don't do that all the time. I use either a rubber dam or I use isolate, one of the two. On a rare occasion, if I have that patient, I will do a dry angle and cotton rolls, but between the rubber dam and isolate, I really find that handles just about everything. But both of those hold everything out of the way. I use one over another basically for my favorite GV Black's principle today, which is convenience form. They both work really, really well. So the next question is, so the company that sells EchoSit is DMG America. That is correct. Like I said, these guys, they don't operate in a lot of spaces, but the spaces that they operate in, they perform really, really well. Let's see, next question here. Do I have any concerns with the color of using just one shade with a bulk fill? Super question. So I've learned in life to, I'm going to say the word in the sentence, but never. I never say never or always. So are there times where I have teeth where one layer doesn't give me maximum aesthetics? Yes. Of course there are those times. It happens rarely though. So if you think about one of the great strengths of a bulk fill and you think about pulling out some of those bigger old amalgams, they're deep. So when you get to that, you get to 5 millimeters, that bulk of material does a great job of masking color that's underneath. You and I have seen that amalgam tattooing that happens on those teeth. And it also does a really nice job of pulling color from that enamel layer and that dentin that's just beneath it. So these restorations look really, really good. All right, so next question here. Amalgam is still better than old generation of composite. Composite is good for business. Now, new generation of composite could last close to amalgam. So I appreciate this. I love a question that challenges the status quo, and I love a question that challenges what we're talking about at any point in time. It's one of the great beauties of dentistry. And so the first half of your question, and I will agree 1000%, amalgam is better than older generations of composite. However, when I say older generations of composite, I'm going to even go back as far as over a decade ago. And the reason I say it is this. Those composites, although older, more time sensitive, more technique sensitive, when you spent the proper time to do them, when you isolated well, they would perform well. Now they had issues like you bring up and like I addressed earlier, which is one of the reasons I love bulk fills so much. You know, multiple layers. So we had gap issues. Multiple layers, we had sensitivity issues. In fact, there was a study about 12 years ago, it was out of Boston University, and they asked patients about tooth-colored restorations versus amalgam. And a decade ago, a lot of patients chose amalgam. And the reason they did was post-op sensitivity. So operator error, right? Let's face it, you and I 10, 15 years ago, because of the limitations of the materials, because of what they asked of us, we often had patients who had post-op sensitivity. Some of that was the composite, some of that was the bonding agents that existed back at that time, and a lot of that was the cure. I alluded to that earlier. The number one fail rate for composites is the cure, and a lot of that I'm here to share with you all. This is not a lecture on curing lights, but curing lights make a big difference. So there was an era where curing lights weren't as good as they are now. There was an era where the manufacturers were putting out curing lights that didn't necessarily give total cure to everybody's shade range or everybody's photo initiator. So those are things you and I have to be cognizant of. That's part of our job as dentists. But today's composite, the quote new generation that the question asker alludes to, will it last close to amalgam? Absolutely. Like I said, I've been doing this for 24 years, and I've seen an awful lot of my composites that are 20 years old. They're still there, and they still look good. In today's space, now for me, that process and the experience I get to deliver for my patients is equally excellent in the clinical result and longevity, but it's a whole lot easier for you and I to do. Let's see. So what has my experience been with post-op sensitivity with bulk filled materials? My experience has been great. I've had no post-op sensitivity with this material as I compare it to what I was using before. Like I said, I'm a pretty meticulous person. What you have to understand about bonding agents is this, and that's really where the problem occurs with these materials, is when you and I are either total etching, partial etching, or self-etching, we have to read the directions of whatever bonding agent we're using. And the problem that I see with dentists and bonding agents is this. You and I get accustomed to using whatever agent of choice is for us, and then we try a new bonding agent, which most likely is superior to what we've been using, but we tend, and this is really sad to say, statistically, we tend to not read the directions, and we treat the new bonding agent the same way we treated the old. So whatever system you use out there, some of those systems are going to ask you to place a bonding agent, scrub it for 20 seconds. Some are going to have you place it and thin it right away. Curing times can be different. However, we have to follow the directions. That's the rate limiting step. So we've got a comment here, can't wait for this material into the Canadian market. Yes, for all of our friends who are a little bit north of where I am in the very sunny Buffalo, New York, if I were you, I couldn't wait for it either. So next question is, wondering what type of curing light I'm using, and have I ever had the failure to fully cure in a very deep subgingival prep? Super question. So I use Ivoclar's curing light, the blue phase. Now, and I'll tell you this, I love that curing light, and I love that curing light because of the tip. So the key factor, and again, if you want to go buy one, that's awesome, but the key factor when I look at curing lights is how the tip delivers the light source. The inherent issue when you look at those of you who are using turbo tips that taper, the trouble with the turbo tip is it focuses all the light in one specific area. Now that's not a bad thing if you and I are tacking a material to structure, but when we're trying to get depth of cure over a span of 1 millimeter, 2 millimeter, 5 millimeters, if we're looking at a bulk fill, you can't achieve that with that narrowed curing tip. For those of you who are using the halogen lights that are flat, so if you turn your light over, it's a flat surface and it's got 5 or 6 halogen bulbs on it. The research challenge with that type of light is that there are gaps between each of those bulbs. So what I want you to do, if you have that kind of curing light, is stand about a foot away from a white wall, or it doesn't matter, any wall really, turn that light on and hold it up to the wall, and what you're going to see is it scatters. So it's the exact opposite problem of the tapered curing light, it scatters the light source, so you tend to get an insufficient cure overall for a different reason. So it's not so much to buy from one specific company when it comes to lights. What it is that you want a light that has a straight tip. And when I say straight tip, I don't mean that it doesn't have a bend to it, but what I mean is that it's the same circumference from the base of the light through the entire tip of the light. When you use a light source that does that, and if those of you who have that, hold that one up to the wall, just like I mentioned for the last one, and what you'll see is a solid circumference of light source that's very intense. That's how you and I make sure that we're getting full depth of cure at the base of a box, because the question asker asked a really good question. It's not just about the depth of the box when you and I inherently look at it. It's about the distance from the top of the matrix band, because that light's so far away. So a diffuse spread of light, not good, and an overly focused concentration of light, not good as well. What brands of composite would last as long as amalgam? I'm going to say, it's a little bit of a loaded question, but I'll go for it. DMG makes a great composite. There are other companies who also make a great composite. So what I want you all to do is your homework. Pull up, I only showed a few clinical slides, but when you're comparing companies and composites, or any material or any bonding agent for that matter, you have to look at, in this space, apples to apples shrinkage, apples to apples wear. All of those things make a difference. And pay close attention to who's sponsoring the research, because if David Rice decides to sell you a composite and David Rice writes the check for that research, is the research as valid as if David Rice gives it to an independent company and lets them do the research on it? Let's see. Thank you for the compliment. I don't really need to read that, but I appreciate it. I feel like I'm totally out of my comfort zone, being that I'm a hygienist. I had my first major connectivity issues for the first 15 minutes of the presentation. Should I be worried about being able to answer the exam questions? You may have a little bit of a worry on the exam questions, and I will defer to Viva Learning on that. I'm sure they have a solution for you on that. I'm going to try to, if I can remember the 5 questions off the top of my head. Oh, I'm getting a message. You'll be fine. Awesome. So thanks for that, team. I appreciate that. So I think I've hit all the questions here. If anybody has anything else to ask, feel free. We've got about 2 minutes of potential time here. If not, again, I truly appreciate your time. I know you're all busy. I know you have many things to do. Please feel free to reach out to me at my email address, david.rice@ignitedds.com. I really appreciate it. You're very welcome. Thank you for the thank you. I appreciate being you here. Oh, one more question we can sneak in. How do I sell a patient on having a filling replaced? Our patients often say they would rather spend the money on vacations. All right, so practice management question. So I'm going to say this. Although we're always selling, I'm really never selling. What I try to do is ask a lot of great questions to my patients, because really the concept of co-diagnosis is the most valuable way to have our patients say yes. So the first thing that you noticed, and I didn't have a lot of images in here, but I have really crisp images. So we have intraoral cameras in every one of our treatment rooms. And our hygiene team, our dental assisting team, they know that when any one of us 3 docs walk into a treatment room, we really want images up of what's going on in a patient's mouth. Now, sometimes they can be images of patients who've got beautiful dentistry, whether we've done it or another dentist has done it. I like to compliment people on that. It's really cool, I think, for us to pat each other on the back and to show people that dentistry really does work. But more often than not, and if your practice is anything like mine, you're going to take lots of pictures of patients and they're going to have those big old amalgams in there. Here's the key. Sometimes you and I rush into delivering an answer before a question has time to marinate. So whether it's the hygiene team, the assisting team, or sometimes if my partner Mark or I or anyone else there takes that image, we like to put it up and we want that image to sit. I want that patient to get a good look at it. And more often than not, what happens in our practice is a patient says, hey, what is that? They're going to see a crack in a tooth. They might not know what it is, but they're going to see that it looks wrong, or they're going to see a dark spot on a tooth, or they're going to see a gap, on that one composite image that I showed earlier that was an older composite that was failing. Like, they're going to see that and they're going to say, why does that one look different than the other one? So that's number one, great intraoral camera images. Number two, we always ask our patients a really simple question. Hey, and we frame it. So, for example, I'm talking to Mrs. Smith, and Mrs. Smith has some big old amalgams. I always ask, Mrs. Smith, there's a lot of things that we could talk about today. They can get complicated. I'm not sure if you're somebody who wants to know the whole story or part of the story. Which one helps you more? And then I get an answer, and then I follow a path. And from there, I'll say, you know what, Mrs. Smith, I'm taking a look at this restoration on the screen that, XYZ hygienist put up for me. What I have to ask you is this: what's more important to you? Is it saving a little bit money today and spending a lot more money tomorrow, or the opposite of that? Most patients get the concept that things are going to cost more if you let them linger. So what we try to do is position it for our patient to understand that they can wait if they want to, but waiting means it's going to cost more money. So last question, and then we have to go here. Is the force of your packing sufficient to form a good contact? So the answer to that is, if you're using a sectional matrix, absolutely. What I have found, back in the day, and this has got to be, it might be close to 20 years ago that I used a Toffelmeyer matrixing system. But if you said 20 years ago I used that, I really had to burnish a band. When you use, like I said, the Triodent, the Palodent, the Garrison sectional bands, and those rings, they're powerful separators of teeth. I don't even burnish that band, because if I burnish that band, it takes a hemostat for me to remove it. So yes, absolutely, if you're using the proper matrixing system, the force of you packing a composite will give you an excellent proximal contact. So thank you all so very much for being here. Please feel free to email me if you have further questions. If I don't get to you right away, I promise that I'll get to you within 3 days. When I'm not in my practice, I'm usually on the road somewhere to speak with some young dentists and some dental students, but I promise I will get back to you. Thank you all so very much for your time, and have a great rest to your evening.